A new study from the University of Michigan says the state's Medicaid program not only helped low-income residents' health, but also helped them do their jobs better.
69% of those surveyed said they performed better at work after they had health care. 55% of those unemployed said the coverage improved their ability to find work. Let's bring in our consumer investigator Hank Winchester as we continue our look at the healthcare crisis. And even with these numbers, though, Medicaid could be in danger for some people.
It could be, Devin, and Sandra. It has a lot of people concerned, as you know, especially those that are on a fixed income, low income, or elderly. They could be the most impacted by the possible changes. 1.8 million. That's how many children, seniors, pregnant women, and disabled people are on Medicaid here in Michigan.
If the health care bill go by, I will be one of the persons that they will be taking it from.
The biggest concern with the possible health care bill is that my husband and I are both self-employed, and so we rely heavily right now on the Affordable Care Act in order to have insurance for our family and ourselves.
Michigan, one of 31 states that expanded Medicaid under the Affordable Care Act, helping low-income people between the ages of 19 to 64 years old. And with this expansion, the Healthy Michigan program was formed.
My other concerns are that Medicaid will be cut and low-income people won't have access to health insurance.
But if this particular health care bill passes, federal funding for Medicaid would be reduced. Right now, it's an open-ended program. The federal government pays a share of the bills. But this plan means Michigan would get a fixed amount starting in 2021. Governor Snyder says he has serious concerns about this proposed plan.
I'm not sure it's a good outcome for Michigan at this point in time.
Lawmakers say the state wouldn't have the funds to cover the loss of federal aid, meaning the Healthy Michigan program would be forced to shut down.
Particularly what's going to happen with Healthy Michigan, and it looks like it would be phased out. Also, I think there's some serious long-term issues with respect to the entire Medicaid program.
3 out of 5 seniors in long-term care in nursing homes are there because of Medicaid health care. And so this is a very big impact on seniors in this country.
And the bottom line, low-income people would be paying a lot more for a lot less coverage. It has many here in our area concerned.
I just feel that with the Trump administration, they're not really in tune with people that are disabled. And that's my primary, fear right now. I'd hate to have that taken away from her. Because otherwise she would depend on me, and my resources too are limited.
A lot of fear, a lot of anxiety, a lot of unanswered questions, but it's important to remember right now, Devin and Sandra, that this has still got a long way to go. They've delayed this vote again, looking to after the holiday right now, so there could be a lot of changes as we learn more about what's in this plan.
Clearly, they'll have to be to get to the votes that they need, so we'll see.
Right.
Yeah. All right, Hank.
Thank you, Hank.